Hi everyone, hope you're all really well. Thanks so much for joining today. My name is Francesca White, anyone who doesn't know me. So I'm Tatler's Health and Beauty Editor at Large, and I'm also the founder and curator of the Beauty Triangle. So I hope you're all well, first and foremost, all in lockdown still, sadly, just allowing our lovely guests to join. And yeah, staying dry in this absolutely disgusting weather. So we're going to be joined anyway today by Dr. Joanna Christie, who has arrived.
Francesca.
Hi, how are you?
I'm great. How are you?
Oh, I'm well. You look so lovely and glowy.
Oh, thank you. Thank you. It's all that lockdown skincare that's been going on. You
I
do
thought you were
too.
going to say you had a good ring light going on, which is what I need to get my hands on.
I haven't invested in one of those actually, but I think everyone swears by them, so I might have to look at that. But no, this is we'll talk about this. This is lockdown skincare.
Oh, good. Well, I'm really excited to have you here. I was just saying, literally just as you joined, that we are together supposed to be talking about the new normal in clinics, because obviously after a long period, it feels like a sort of semi-hibernation for many clinics all around the UK. Everyone's slowly starting to sort of come out, aren't they? The doors are reopening, I think, really as of Monday next week for some people, and even sort of into early July. So I guess it's just a nice opportunity for us to talk about, new protocols that patients can expect, the treatments that you think are going to be particularly in demand. And I guess, just how the world of virtual is even going to look going forward.
Yeah, it feels like everything's coming back to life again, which is great.
Like spring all over again.
Exactly.
So a little bit of background, obviously, on Dr. Joanna Christou. You've worked at the Cosmetic Skin Clinic now for about 5 years, is it?
5 years, yeah.
Okay, super. Under Dr. Tracy Mountford, the founder, doing, I think, mainly sort of injectables, but you're also a sort of dual qualified dentist and aesthetic doctor. So I suppose, really, firstly, when are you planning to open, I think is the question that everyone wants to know, myself included.
Yeah, so we are actually opening July the 4th. And it's not that we can't open before that, it's just that we want to do everything really to the highest standard. So we don't want to rush things. We want to make sure everything is absolutely perfect before we embark on treatments again. So we've decided to go for July the 4th as a clinic.
Yeah, I think that's a smart move. And I mean, what are the sort of changes that patients, such as myself, such as everyone who's sort of, joining us, what changes can they expect when they return? I mean, we're going to be looking at a very different place than the one we left 3 months ago, right?
It's very true, but because we are a medical clinic and we are CQC registered, our standard of infection control is already very, very high. So a lot of the changes are in relation to preserving social distancing as per the government's guidelines. And so we will be temperature checking patients on arrival, providing face masks if you don't have your own. But some of the changes will be more around the logistics within the clinic. So, for example, unfortunately, we can't provide beverages, we can't provide refreshments. And
I guess what you're doing is making it not a sort of place where people sit and sort of, while away a couple of hours waiting for their injectables or whatever.
Exactly. And we have some very popular hot chocolates and cookies and things like that, so I don't think that will go down very well.
They will be off the menu.
They are off the menu.
And I guess people can't, be bringing guests with them anymore. I've heard that's sort of going to be the case going forward.
Yeah, so we will be having discussions closer to the time with patients, but we will ask people to arrive at their appointment time rather than too far in advance. And as you say, not to bring anyone else with them. And this is to minimize the number of people in the clinic at any given time so that we can adhere perfectly to the social distancing guidelines.
No, it's all smart. I mean, from a patient's perspective, then, what are the things that we can be doing to make your job easier? Because it sounds like you've got a hell of a lot to manage now, not only having to deliver these, sort of very complicated treatments sometimes, but also doing it in a way that's, very safe and ethical and really prioritizing the patient's well-being.
Yeah, I'm glad you asked that question, because actually that was the most popular question that came up when I put a shout out for questions ahead of this live, is what can we as patients do to facilitate the process?
That's so nice to hear, isn't it? That people are so
Yeah,
invested in, trying to, have that two-way relationship, which I've always said really should be behind every good cosmetic procedure. It's the doctor's job plus the patient together to get a great outcome. So that's amazing. What are your
yeah,
thoughts?
there's a huge relational aspect to it. So the response to that is really to firstly to acknowledge that everything we're doing is for everyone's safety and for everyone's best interests, to arrive just on time for the appointment and not beforehand, to ideally not be wearing makeup, because then that reduces the amount of contact time within the clinic. I mean, we still have
otherwise you're having to take it all off for somebody.
And that's fine, we can do that because we will be in full PPE and we will have masks and visors, etc. But the more we can reduce that direct, close face-to-face contact, the safer it will be. So if you can remove your makeup beforehand, that will be fantastic. And then also just managing expectations in terms of knowing that there won't be a chance to sit around and have a beverage, etc., and sort of being aware that that is how the clinic will need to run from a logistical point of view. But everyone's been super patient, really understanding, and really keen to have everyone back into the clinic and welcome everyone.
I know. Well, I think everyone's really missing the sort of face-to-face contact, and it's a huge part. I speak to doctors and surgeons such as yourself, on a very regular basis, and most of you you talk about your job in aesthetics very much as almost being a psychologist sometimes and a friend to your patients. And I think that there's a huge psychological benefit to the treatments that you give to patients. And so I'm sure as much as they miss the effects of the Botox or the filler, they also probably miss that communication they have with you, and vice versa as well.
Absolutely. I mean, and we haven't completely stopped communicating. We've been doing a lot of virtual consultations. There's still been a little bit of that ongoing relationship. Of course, we're restricted in what we can do virtually, but we've been working very, very hard behind the scenes and maintaining contact with people wherever people have needed us. But you're right, it doesn't replace that direct face-to-face personal interaction that I think actually all of us are missing. We're all missing kind of having those hugs from friends and family.
I know,
aside from those professional relationships. So that'd be amazing to get that back.
And so what do you think, when people are coming into clinics now, and, we've not been there for about 3 months, perhaps, even longer, because not everyone was probably lucky enough to get the appointment on the very last day before everyone went into lockdown. So what are the treatments that I suppose we can come back in, book, and get maximum sort of immediate benefits from?
Yeah, well, the most obvious thing I think will be toxin muscle relaxants, because that generally only lasts about 3 to 4 months on average. So the majority of people will be missing that for sure. And so I think the philosophy for this should be to do those quick win treatments, which is injectable, so Botox and filler, restore that kind of vibrancy and health again that we're all used to having, and then have a regroup and think about the longer term treatments such as skin tightening and collagen boosters and lasers and things like that. But I think in the first instance, it's got to be a sprinkling, a quick refreshing of all the injectable work, get back
just to get our faces back where we're used to seeing them.
Yeah, and then go into kind of picking up where you left off with the longer term treatments and the things that take a bit longer and last a bit longer.
Because that's certainly an approach that you have at the Cosmetic Skin Clinic. Many doctors sort of nowadays work in this way. It's very much seen as a staged procedure, isn't it? Sort of getting your face into a place that you're happy with. And as you just said, there are energy-based devices, there are lasers, there are injectables. So I suppose, where does that leave patients who have been on that journey with you so far? The ones who do they've committed to this very strategic plan, they sort of have all of the treatments lined up, and then they've been cut off. Where do they sort of fit back in, and how can you sort of pick their treatment plan back up again?
Tricky question, because actually a lot of that will be on an individual basis, and so it depends on how long people have been doing treatments for and where they are in their plan and things like that. So it's hard to give specific information, but as a general rule, I would say most people will be maintaining their therapy or skin tightening from other device, and so we need to just kind of look at the timing of those things. But I would definitely say that in the first sort of contact point, restoring those injectable things first is going to be the most satisfying and the most kind of strategic thing to do, and then start to look at the skin quality and the tightening treatments at a later stage. But it will vary from person to person, because some individual might be coming up for their next cell therapy treatment, in which case that's going to give them the biggest initial boost, and so that would be the right thing for that person.
Yeah.
But I suspect it'll be mostly injectables.
And speaking of stage treatments, I know that you and I spoke previously to this, and you were saying that actually you've had a lot of brides-to-be, obviously, who were planning on a big day, you know, sort of about now. And obviously plans have had to be sort of shifted and regrouped. So where has that left that cohort of patients who are probably working towards sort of a year-long sort of program to get their skin in sort of, you know, the optimal quality?
So my bridal programs are usually about a year long, and summer is a very popular time for weddings. So there's been a lot of upset around that, and a lot of, I mean, in terms of the cosmetic work, it's not gone to waste. We'll have to just reevaluate when a new date is set. I know some people are still hoping that their weddings will go ahead in the summer, in which case we'll just kind of rejig things and we'll kind of pick up from where we left off. Yeah. Others are postponing it for a whole year. So I have a whole bunch of people who are now not getting married till summer 2021, so we'll have
they've got all that extra time to play with suddenly.
That's
the only silver lining to having your weddings.
You have to see the silver lining.
I know. Well, we're supposed to be getting married in December, and you know our backup date is December 2021 now, but at least that leaves me with more than your sort of, you know, requisite year for brides to be, because if the wedding does go ahead in December, then I'm very, very behind on all of my prep, and I need to get in on July the 4th.
Not at all. You look amazing.
Oh no, I need a ring light. But what about other parts of the body? I mean, are we going to be more focused? I suppose, you know, we're going to emerge into summer, you know, even though, you know, this doesn't really look like summer right now, but you know, we're going to sort of suddenly be exposing sort of parts of our body and skin that haven't seen the light of day for about 3 months, unless you've sort of been sunning yourself in the garden permanently on lockdown. So what are the treatments, I suppose, that people can sort of safely and efficiently sort of work back into their sort of regime when it comes to aesthetics?
Yeah, so a couple of thoughts on this actually. So it'll be interesting to see what the uptake on laser-based treatments is, because a lot of people would go away for summer holidays, and so you'd historically avoid lasers pre-holiday. But because we have such a strict travel ban right now, I suppose a lot of people will be having staycations rather than vacations, and so there may be more of an opportunity to perform laser-based treatments around this time of year.
Even if we're still holidaying in the UK, that's still okay, as long as it's not intense sunlight.
Exactly. So the UK sunlight is not usually too hot to worry about, but it would depend on also the skin preparation prior to the laser. So you know, we'd have to speak to each individual and see. But I think the other big thing might be Coolsculpting, because we've all been home and perhaps not able to maintain our exercise regimes in the way we wanted to. So I think
perhaps drinking a bottle of wine per night plus, if you're in our household.
Yes, everyone has their own thing, don't they? But
exactly.
Coolsculpting, I think, will be hugely popular, and I know Magda and Ria are at the Cosmetic Skin Clinic are raring to go to see everyone. So
oh my goodness,
I certainly need a little bit.
I know, we all do. It's funny because you'd think that actually, you know, people in lockdown, you know, we have all this time and, you know, we can motivate ourselves. But I don't know about you, but I think it was sort of mid-March when we sort of went into the state. It was dark, it was depressing, and it was really just seen as an opportunity to, I don't know, be cozy and have a few extra glasses of wine and some more carbs. So no, I agree with you. The fat freezing is going to be a good one. And how does that work with your sort of new hygiene and safety standards? Because I know we've sort of spoken about injectables, and those will have an immediate benefit, but, you know, being strapped up to a Coolsculpting machine, for example, you know, you can be on there for anywhere from 40 minutes to a couple of hours if you sort of really do a long-term program with that.
Yeah, so all patients in our clinic, regardless of what the treatment category is, will be escorted from the front into their treatment room. So the idea is we operate kind of a one-way system around the clinic, so we don't have people passing each other in the corridor. Yeah. So then the interaction is simply between you and your practitioner. So where Coolsculpting is concerned, because of course it's majority of the body is where we're treating, actually you can wear a face mask the entire procedure, and so that's relatively low risk, and our practitioners will be in PPE as well, so wearing masks and scrubs, etc. So that will be probably much lower risk. Although you'll be on site a lot longer, you'll have less interaction and certainly no kind of close contact facial interaction. So I think that would be fine, to be honest.
What are the treatments, I mean, on that note, that you have to be particularly mindful of when you're delivering now? It's obviously those ones that are so close to the face in that case.
Yeah, so I mean, as in sort of aesthetic doctors, we do a lot of injectable work, and I'm a lot, in around the face, examining the face, and get very close and personal. When
I know. Well, you're also surgically trained. I remember you and I spoke, for an interview years ago, I think, and you were saying that when you inject, before you inject, you sort of feel all the muscles and the bones and the soft tissues in the face, which it's an amazing approach to sort of, giving somebody the treatment.
Thank you. Yeah, so that we don't want to, and we're certainly not going to compromise treatment. What we will have to do is to keep face masks on for as much as is viable, but then when treatment is being undertaken, the face mask will need to come off. And so as a practitioner, I will be, fully with my mask and visor and everything. So I will be wearing PPE, but we simply can't have a face mask on when you're having injectables around the facial area.
Yeah.
And again, that's fine. There'll be ways to minimize the amount of interaction and the contact, but for the actual procedure, the patient won't be able to wear their face mask.
And what about when it comes to, and what happens when it comes to lip injections? Because that's been the cause of a lot of, debate, whether they are safe to be administering. But, it's still a very popular treatment, particularly now. There's been a huge uptake in lip filler in the sort of past year, 2 years. So how are you going to get around the complications with that?
Yeah, we have been looking at a lot of the different discussions around ways to approach that, and there have been discussions around, using mouthwashes beforehand to reduce viral load, etc. Reality is there aren't many things that will directly reduce the risk. So again, it's just about minimizing the amount of close contact as much as is viable, and minimizing the interaction of people with others around the clinic. So the treatment duration will be kept as short as possible, as it always is. In the past, we might, for example, have people using ice in the waiting room, but now we will have people staying in their room and using ice. So there are factors around the sort of logistics of the procedure, but we would still consider lip injections a safe treatment with proper infection control, proper PPE, all well done. It should be no higher risk than any other injectable treatment.
Yeah. And what about sort of pain medication and numbing cream? Is that all safe to sort of go ahead as it would have normally been? Albeit we won't be sat in the waiting room for sort of half an hour beforehand doing it, I imagine.
Yeah, so there'll be no kind of sitting in the waiting room with cream on. It will be straight into your own treatment room, and if there's any anaesthetic cream needed or any pre-medications needed, it will all happen within your own treatment room. So it's all about minimizing sort of contact with all the people on site, and of course we're only allowing people on site who are low risk anyway. So if someone comes to our door and is seen to have a high temperature, I'm afraid we're going to have to turn people away, because we want everyone within the clinic to feel safe. And so if there's any potential risk, we're going to have a very sort of low level of tolerance for that. So and of course, people, if they have a temperature, if they feel unwell, they'll be asked not to come to the clinic anyway.
I think we're all going to see, and I think clinics are already starting to do it, a lot more communication, and people obviously reaching out to patients before appointments, even explaining what this journey is now going to look like. I've had videos sent to me, infographics, very sort of step by step, this is what you can expect. And exactly as you say, this is our new protocol, and if you feel unwell, please don't come in. And I think that's something, that people need to take quite seriously, that sort of do not come in if you're experiencing symptoms, or if you're just feeling under the weather. It's just not worth it right now. And
that message has been drummed into us for the last few months anyway, so I think
we all know
everyone
how
is
to
so
stay
aware
at home.
of it.
We know how to stay at home and wash our hands.
Yeah, I mean, that is one of the good things that I think that will come out of this, is that such an awareness of hand hygiene and infection control, which perhaps wasn't there before. So I think this is, you know, this is, I mean,
it takes a pandemic to get, you know, people washing their hands properly. But I mean, obviously the side effects of all the hand washing are the dryness and the sort of, and the irritation and the dehydration. So I mean, any solutions for that when we all get back into clinic? Apart
I think
from,
there'll be
super thick hand creams sort of all the time.
Yeah, there'll be a lot of, I think, dry hands at the moment, because we are all washing our hands so much. I mean, I'm used to doing that because as a surgeon, I do wash my hands all the time anyway. Things like Profilo, I think, will be super popular when we do come back, because that's so deeply nourishing and hydrating. And
they call it an injectable moisturizer, don't they?
Exactly.
I mean,
it's exactly the perfect thing.
I want to ask a quick question before it disappears off the screen. It's one from lovely Beatrice Aiden who's watching. Hi B, if you do feel unwell, will the cost for a missed appointment be the same? God, you can tell I need my glasses for this. It's obviously on a case-by-case basis with clinics, isn't it?
Absolutely, it's on a case-by-case basis. It depends. You know, most treatments don't need a deposit anyway, so if you're unwell, of course we'll understand. We're going to be sympathetic towards that. But that's about calling the clinic, having that relationship with the clinic, explaining the situation. Certainly we wouldn't be unreasonable towards anyone in that regard, because we would understand, but it is case by case. It is dependent on the treatment you're having, etc. So I guess it would be a matter of, you know, each individual having that discussion with the clinic that they're having their treatment with. Exactly. I can't speak for other clinics, of course.
I guess it's all about communication, and I think, you know, that's something that's really going to be a priority, you know, patient doctor clinic communication going forward. I think, you know, exactly as you said, you know, we've been able to use virtual tools to stay in communication with one another, which has been amazing sort of during lockdown. So hopefully that sort of sense of togetherness and community will continue, you know, even you know, while everyone's in PPE and looking sort of frankly terrifying, and patients are sort of still a little unsure about what the clinic is and how it sort of operates. But I think we just need to keep talking about it and keep talking to one another.
I've been a bit mindful of that, because of course you're not used to seeing us in PPE, and it kind of looks a bit daunting and a bit
I think it's terrifying if you're not seeing that
the same people.
But how can we tell you apart? That's going to be
all right, Joanna, across my forehead.
I know, exactly. You all need to like have hats or like accessories to sing, like name tag. I don't know. No, that's going to be a real shift, obviously. And you know, let's talk about skin as well, because that's the one thing that we have been able to sort of seize control of and really steer in a positive direction whilst we've been sat at home. So really sort of what are the things, even up until the point that we get back into the clinic, that we can be doing to keep turning our skin over and really get it in the best possible condition for when we do finally get that sort of gold dust appointment?
Yeah, so one thing we have been doing with a lot of patients during lockdown is kind of upping the skincare regime, because we have an opportunity whilst we're not face-to-face interacting. I mean, albeit there's a lot of virtual contact, there's not a lot of face-to-face contact right now. So we've had the chance to kind of ramp up and get really good, healthy, glowing, robust skin for a lot of people. And that's involved a lot of topical prescriptions of retinols, for example, which creates a bit of peeling and irritation. And those of us who do use retinols regularly will be quite familiar with that. But once you go through a process, the skin is glowing and it's vibrant and it's healthy. I mean, Francesca, you look fantastic. What have you been doing in lockdown?
I'm sitting by a window. Somebody told me that you need a direct light source when you're on camera. I know nothing about this, but like I said, I need the ring light.
Good lighting goes a long way, and I know a lot of people have had to be very clever with their lighting during the last few months, because if you get up super close, you'll see all the kind of the lines and the wrinkles.
Oh, exactly. I'm sure that all of this screen time is definitely fueling our fixation with like every little line and wrinkle. I'm really trying hard not to look at my forehead throughout this entire conversation for that reason. But no, I completely agree. I love a peel. I've always loved a peel, even pre-lockdown. You know, strip all the skin off. You know, as far as I'm concerned, just get it back so it's sort of lovely and fresh and clean clean and shiny. But yeah, like the peels or a nice sort of retinol based product at night time. What do you use on your skin? What's getting you so glowy at the moment?
So I like the Zeo range, the Zainabaji range. So I use that day to day anyway. But what I've done is just really cranked it up and I've gone for it. So I've used, I don't know how familiar you are with it. I've used the Radical Night Repair product, which is a 1% retinol. And Zeo kind of published a regime for that where you use it morning and evening, quite a few pumps, and over the course of a week or so. And you just peel away, and I've done that actually 2 or 3 times, so I've kind of maybe gone a bit too much on it, but
no, not
I haven't had anything else available, so I've,
also you're not client facing, you know, you're not, you know, really sort of within reason leaving the house too much, so you know, this is the time to do it. Is that part of the sort of super intense, because Abaji is obviously well known for its skincare regimen, isn't it, which is prescription only, I think. So is this part of that range, or is this the sort of the one that you can buy over the counter?
Yeah, no, it's part of the super strong stuff. So I definitely would recommend anyone who's considering something like that, you need to liaise with a practitioner who's familiar with the protocols and the products, because anyone who puts this on the skin without that kind of tailored advice might get a little bit of a shock when they start to see their skin flaking off and being irritated and peeling. But with everything under control and with the right balance of products, it's just wonderful to use. So now that I've kind of used it to its maximum potential, I might try and see if I can weave that into a little bit more of a day-to-day regime for myself to maintain that level of glow. So I feel like my skin's there now. So hopefully we can keep that going.
It's so nice. Layla says, I did that regime. It was intense, but worth it. I mean, look, I've never actually tried any Abaji products. I'm really sort of ashamed to admit that, because I've heard such great things about them. And I think exactly as you say, I've always been terrified of the associated downtime with them. People have said it's a real commitment to do that, but, you know, when better than lockdown? I just wish I'd sort of, you know, placed an order sort of on March the 21st and, you know, nearly 3 months later was ready to be like, ta-da, here I am.
Yeah.
Grand
I mean, there are ways to play around with the concentrations and the frequency of use and the strength. So it doesn't have to be as aggressive as what I'm referring to right now. There are ways to kind of use it a little bit more gently. It means it takes longer to get your end result ultimately, but you can do it in a much more kind of measured, controlled way. And of course, as you say, lockdown was the perfect opportunity just to blast it. As Layla's saying, 3 to 5 pumps morning and evening. She knows what she's talking about.
She knows her stuff. Well done.
So that's what I did, and that's quite an aggressive way. You know, you have to be prepared to go through the process of allowing the skin to peel. And it takes a few weeks, and then you get there and it's great. But as I said,
what about like the quick fixes? I mean, what if we don't have access to get, you know, an Abaji prescription right now? Is there anything else that you think is great, you know, that will give us results within a week and really get the skin turned over quickly and get it beaming?
Yeah, tricky, because actually if something is going to cause a lot of downtime and a lot of skin rejuvenation, that definitely falls under the category of a prescription and a medical grade treatment. So anything over the counter is not going to have the same degree of impact. It's not to say that it doesn't work, and I know you're a massive fan of at home. It won't be as strong, but you're a fan of at home treatments. I know you kind of talk about sort of needling and things like that. I mean, what do you recommend for at home for yourself and for people who come to you looking for advice too?
It depends. I think, you know, if you're looking for literally a kind of quick pick me up, I think you know, a face mask that you've kept in the fridge or freezer is a really nice way of just, you know, bringing some hydration straight back to the skin, and, you know, you can really see that sort of plumpness and juiciness afterwards. I mean, I think every brand under the sun now does like a cellulose mask, but I've been using ones by 111 Cryo. Royal Fern do really nice ones. Who else is great? God, I've been trying so many recently. But otherwise, I think, yeah, the brand that I love actually at the moment is Skin Better Science. I don't know if you've used any of their products.
Yeah, it's a great brand.
I think they were actually formulated by somebody who worked under a bargee. There's a bit of a link there, I'm sure somebody once told me. But I've really noticed really tangible differences in my skin since using their products. You know, it's much glowier, it's firmer. They've got a great brightening serum. I don't remember the name of it, but it's in like a rose gold tube, and it's great. I use a couple of pumps of that in the morning, and you know, it sort of evens out pigmentation, which, you know, thankfully, because, you know, not having been out in the sun sort of so much just yet, isn't too bad. But normally I'd get quite bad pigmentation across my nose. And then at night they've got a really nice, and again I forget the name, there were these long scientific names, but it's basically an encapsulated retinol, and they sort of combine it with another acid, and I think it sort of buffers it, and it means that actually you can get amazing results with you know, very, very minimal irritation. I haven't experienced any irritation whatsoever since using it. But I guess the other thing that I'm obsessed with, and again, any brand I'm sure does it or will have one in the range, any cosmeceutical brand, is basically like an AHA based cleanser or something with enzymes or something with a little bit of like an acid to it, because, you know, again, it sort of just, it seems to sweep away all the dirt and the toxins, and it unblocks the pores, and it just leaves everything super shiny. And, you know, I can't get enough of a foaming sort of glycolic wash in the morning.
Yeah. And all of those things are fantastic, and they play a role, and they all do something slightly different. And as you say, they all give you that kind of instant pick me up on that sort of dermal layer of the skin.
Yeah.
And when we're talking about, I mean, the things I talk about is the sort of deep structural kind of, you know, long lasting treatments, which in combination with everything you've described is the best outcome. But
yeah,
you're right, you know, if we're still stuck at home, and a lot of people will be working from home for the foreseeable future, then there are lots of things you can reach to over the counter which will give you that quick zhuzh, and I love that word, zhuzh.
I know, it covers all multitude of not quite knowing what to say, but zhuzh always does it.
But everyone knows what it means.
Zhuzh, I know, it's so true. It's probably in the dictionary somewhere, but I wouldn't even know how to go about spelling it. It's one of those words that, you know, you use it as, you want to use as an editor or a writer, and you're like, how do I even spell that one? Speaking of zhuzhing, how, if that's even a word, any tips on how we can sort of prolong our injectables until we can get into clinic? Because I'm sure if you've been closed since, I think, you know, you closed just before the lockdown, so March the 20th or something even, you are going to have a waiting list as long as your arm for people trying to get back in. So chances are I'm probably looking at sort of end of August or something at this rate with you. So what can we do to maintain things like, you know, but Botox is the immediate one, isn't it?
Yeah, so that's tricky, because these things are based on metabolism and genetics, and they have their own longevity anyway, which will depend on how long you've been doing them for example. So there's very little you can do at a structural level to get Botox to last longer or get your filler to last longer. So the focus would be more about then maintaining the robustness of the skin and the collagen with all the things that we just mentioned to kind of keep everything firm and healthy, so that when you get back into the clinic, the skin quality is good, and when you restore all of these other things, it all just kind of lifts and comes together.
It clicks all back into place again.
Yeah, exactly. But to the point about long waiting lists, I mean, the team have been absolutely fantastic. We've opened extra clinics to try and accommodate, because of course the backlog from March till now is huge, and everyone's just kind of really pulling together and really excited to be back. So we should have enough availability over the next month or two to see everyone who wants to be seen. So don't worry, it won't be August. If you want to come and see us, we'll
that's
make
fine.
it
I've got you on Instagram now and WhatsApp. I'll just be like, Joanna, come over. No, I'm joking. What are you missing on a personal level? You know, can you say this? What are the treatments that you're sort of desperate to get back into clinic for?
I mean, I'm due an therapy now, because I usually have it every 2 years or so. So personally, I am using therapy to preserve and prevent and maintain, which keeps everything kind of, you know, tight.
It's that foundation, isn't it? Just getting everything back. It
works beautifully. So I certainly will be looking to get myself one of them as soon as I can. My Botox, as you can see, is kind of starting to
your Botox is at the perfect level. You only see your forehead lines when you physically move your eyebrows, otherwise it's smooth.
But that's how I keep it anyway. I keep it super duper light so that the expression is all there. And I started quite young. I was 26 when I had my first Botox.
Because you just looked in the mirror when you were 26 and you were like, my lines are bothering me and I want to do something about it, or maybe because you're a medical professional and you just were curious about it, you knew it would give you amazing skin.
Well, I was in the industry, so I knew what it would do, but also I had a very strong frown line because of so much studying and, as you say, lots of exams, etc.
That's a hard work.
This one was starting to bother me at that age, so I thought, oh, just do a little bit and, you know, I'll see how it works for me, kind of thing. It is on the slightly younger side. Most people, if they're really in tune with their faces, will maybe start treatment in their 30s, but using preventive...
I think I did it on my 30th birthday, or in preparation for my 30th.
I love that.
That was my milestone.
So preventative little tweaks, even at that age, really go down very well, because you're not looking to augment or change the anatomy. You're just looking to preserve. And so these tiny little sprinkles of Botox.
The baby Botox. Or the meso Botox. I mean, there are so many names for it now.
Yeah, and I mean, basically, they're all the same thing. It's just like tiny little...
We're reinventing the wheel.
Tiny little doses. So someone's asking how old I am. So I've been having treatments now for 10 years. So you can do the maths.
So you go maths. Were you listening earlier when she said what age she started doing it? I don't think there's no wrong or right age to do any of these things. But you know, you said earlier there are obviously a number of variables when it comes to how long your Botox even lasts, for example. And explain that to me. Is it people who have been having it for a really long amount of time, have built up a resistance to it, or is it that their muscles are much more receptive to it and therefore it lasts longer?
Definitely people are receptive to Botox in different ways. So some people, no matter what you do, it will be dead on 3 months. The Botox will wear off and they'll need it repeated. Yeah. Others, is that you?
I think so. Yeah. Sadly.
Others will find that it might naturally last a little bit longer, and there are a lucky handful of people for whom they might have a treatment and 9 months later they might need to repeat it. So there is a spectrum. 3 to 4 months is the bulk of people, and it is the average, but some people do find it lasting a little bit longer.
Yeah.
So there is that element. The second element is how long you've been doing it for, because, for example, using, let's keep with the Botox narrative, is that as you relax the muscle, because it's not tense, because it's not having a workout, the muscle softens, and so over time you might need less to get the same result. So in the same way that when you're in a gym and you're working out your muscles, the muscles grow. When you're using Botox and you're relaxing the muscles can soften, and they learn to behave, and they learn to be less intense and less bulky. And so over time, as you repeat treatment, and again, I'm not talking about paralyzing muscles, I'm not talking about freezing muscles, I'm just talking about
just softly sort of modifying
modifying how they behave. And so over time you'll see treatments lasting longer. Then there are other elements that are less kind of well documented, like the metabolism and genetics and things that will play a role in how long the Botox lasts. And so you sort of put all those things together in a mix, and you come out with an understanding of how each individual responds to treatment, and that is so individual, and it changes for that individual over time as well. So here's where that relationship with the practitioner is so important, coming back to that again, because getting to know your practitioner, allowing the practitioner to get to know you, both on a personal level, but also how you respond to treatment, means that your treatments get better and better and better over time, because you just kind of build an understanding of each other. And that's where it's so satisfying, because it's like you're greeting an old friend, and oh, how's so and so, and you catch up and you do the treatment, and you just know that you're going to nail it every single time. And it's it's a wonderful.
I always say finding an aesthetic doctor is like finding a personal trainer or finding a husband. You want to have a long-term relationship with that person, because that's how you're going to get the best results. And I think that there's a lot of very sort of trend-led treatments and techniques and products even coming out, and I think there's definitely a sort of inclination. I can sort of feel it as a consumer as well, to sort of hop around and try different people for different things. But I think you're really right, and particularly coming back after something like lockdown, I think it is really important that you sort of put yourself back in the very capable hands of the person who got you to where you are in your stage of the journey, and allow them to sort of pick it up and run with it again.
Yeah, and you need to trust the person that you see, and it's more than trust. You need to actually like the person you see as well, because everyone has different styles and different flares and different approaches, and so there's a very personal element to having these treatments. And so, as you say, once you've found that person that's right for you, and there is an injector for everyone, whatever it is you're looking for, there'll be someone out there who can do that
your
for
injectable
you.
soulmate.
Yeah, and then once you've found that person, stick with them and build that relationship and work towards kind of long-term goals together, because then it is just amazing what you can do, you know, with that kind of teamwork mindset.
I agree. And then last question, because I know we've sort of chatted for a while now, I don't want to keep you for too long, but you know, how is the world of virtual going to fit into what you're doing as a clinic? I mean, obviously you said earlier it was an amazing way of you keeping in touch with your patients, and obviously sort of safeguarding sort of what was going on with their skin whilst we're in lockdown. But is that reliance upon virtual consultations going to continue? Do you think it will fade away? Do you think it was great for lockdown but actually not so applicable in day-to-day life and the job that you do?
Yeah, so again, I had this question quite a bit during lockdown from lots of different avenues. Personally, I don't think I will maintain it, because there is such a huge element of my ability to assess someone face to face and test the nerves and look at the, you know, the bony structure, etc. That fine, you can get an idea of virtually, but it's not the same as the laying on of hands and feeling everything and kind of really understanding how everything works.
Exactly.
So it's been a great tool, and it's been a wonderful kind of opportunity to kind of keep in contact with people and give advice where needed. But personally, I won't be kind of pushing forward with that to any kind of measurable level. Some of my colleagues and friends, I think, are intending to use virtual consults going forwards in some shape or form, because they found that it's worked for them.
And maybe in the form of like a follow-up or something.
Yeah, I mean, it's great for giving advice and it's great for chatting, but if you really kind of want to get a close-up look and really talk about your individual treatments and the detail of what that would involve, you can't replace that face-to-face interaction. So I think it might change the shape of aesthetics going forwards, but personally I still prefer that face-to-face.
I think it will definitely change the face of aesthetics going forward, but I also think it's very personal to the practitioner who is prescribing it. You know, I know that there are some practitioners who live and breathe the human element of what it is that they do, and you know, they're craving that sort of patient back in the consulting room. I think there are other practitioners who have very seamlessly sort of adopted virtual tools and find it a very efficient and very rewarding way of sort of dealing with patients. So I guess you're right, you know, that there's no sort of one size fits all, is there? It's just really down to the clinic and the practitioner and the patient, which is basically at the crux of everything that we do.
Yeah, and also the procedure that you're doing, because some things lend themselves more to face-to-face consultation, and some might lend itself more to virtual consultations. There may be a more integrated approach going forwards, but as you say, each individual clinic and practitioner will have their way of managing that in the long run. I think everyone will just be so keen to get back into clinic initially that there'll be an influx, and then we'll kind of find the, you know, the level ground after that.
Well, thank goodness that you're opening again on July the 4th.
Yeah. Can't wait to be back. It's going to be exciting.
I know. Well, I will have to make my appointment ASAP and try and get in there before late August. And it's been really great speaking with you. I mean, I think there's some really sort of positive steps that everyone's starting to take together to get those clinics reopened and to get all of, you know, everyone's Botox sort of back on again. But it's, you know, it's nice to have that light at the end of the tunnel, isn't it? And, you know, get back into the places where people can do their jobs and, you know, and be happy doing that.
Absolutely, yeah, and we're so grateful to all our patients who've been so understanding and so patient with us, because it's, you know, it's unprecedented circumstances. We're so ready to get going now and have everyone come back and, you know, welcome everyone back into the clinic. So we're very excited to see everyone again.
Oh, you're such a lovely team at CSC. I think everyone's going to be very excited to come back and see you.
Absolutely.